So, good afternoon, friends. Uh, I have come. Today is my English video day. So, I'm doing my English video. So, I just had a, you know, walk. So, I will, today, I'll just show you my smartwatch. Today, it's 2,699 steps and 2.2 kilometers. Let's see. 2,999 steps. 2,999 steps. So, what the doctor told me, um, 2000, I'll show you the summary. Sorry, 2,699 steps. 2,699 steps. So what the doctor told me that yeah, this is the summary. It's 2.2 kilometers and 2,699 steps. So what the doctor told me is that you have to do it in a little staggered fashion, not not too fast, not too slow. And today I thought the days I'm not going to gym, I will start walking. So it's very dry in Bangalore, dry weather. So 2,699, you have to go 2.1 to 4 to 6 to 10 kilometers I can walk in a day. 10 kilometers is 10,000, 8 kilometers is 10,000 steps, and uh, and that's the way it should be. It should not be, I mean, I have to do it in a staggered fashion, like two 2,699 to 5,000 steps to 10,000 steps, like that, not in a stretch. mm, because I'm just, recovering from the that Monday, the panic attack. So so it will take time, and it is to be done in a very staggered way. So yesterday I had a talk with my aunt from America. She was working with the Army Community Hospital, um, in Tennessee. So she told, you don't have depression. We had a long talk. I mean, a long talk, about 1.5 hours. She told, you don't have depression, because I have seen a lot of patients in the army hospital, that those who have depression, from I mean, I can, from the talk I can find out that whether they have depression or not, because depression is not a measurable thing. So you don't have depression. So my first doctor, this Dr. Kaustav Gosavi, has written in its diagnosis that I had depression, I had schizophrenia, I had bipolar disorder, and yeah, bipolar disorder, schizophrenia, and depression. So those are ruled out. She said you had, after COVID, a little bit of insomnia, which is very very natural after an infection. So the protocol was to give you a half tablet of Q-tip. In America they call it a Seroquel. Half tablet of Q-tip and made you get out of the office chamber, and that was to be given for 1 month, but he has stretched you for 7 months with zolpidem tartrate, which is not, again I have told you, again so many doctors have told the same thing, zolpidem tartrate, which is a wrong medicine he has prescribed you. Because of that you are having these panic attacks and this anxiety, panic attacks, and little bit of insomnia problem. So this will take time. This you have to exercise, you have to, this takes time for the withdrawal symptoms to go, because I have been drastically reduced. Taper, stop. But the withdrawal symptoms stay for 3-4 months. See how much I am suffering because of Dr. Kaustav Gosavi. You tell me in your comments that what I should do with the doctor. I have not decided yet. I have not decided yet that what I should do with him, because I see no reason that he should give me zolpidem. In America, in everywhere, in excuse me, in everywhere, zolpidem is considered as a date rape drug. As a date rape drug. If you are going, if a man has bad intentions, he can spike up the drink and with zolpidem and make someone drink it and rape that person. It can be, at least in all other countries, it can be a man or a woman, anyone. So it's a date rape drug. I don't know why he prescribed me that medicine, for which I'm suffering so much. So, and she also told that if someone is without a valid reason giving a diagnosis of schizophrenia, bipolar disorder, or depression, at least in all other countries, they are considered as a as a mm, as a as a basis for divorce, because no one wants to stay with the schizophrenic or with person with a bipolar disorder or depressive, those who have clinical depression, with that kind of person. I mean, it is their choice, but the rules are there. I mean, there's a humanitarian ground, but the rules are there. So, and it can also lead to job loss, because if you are declaring that, maybe they will perceive as a threat, perceive you as a threat. So these are, anybody can file a lawsuit. So I still have not decided what I'm going to do. I have not decided what I'm going to do with this Dr. Kaustav Gosavi. So I know I should not take name, but he is like the amount of suffering I went through because of zolpidem is putting me under a lot of pressure, mental pressure, to take his name. Under a lot of mental pressure to take his name. I don't want to take his name, but he has put me into lot of mental pressure. My whole personality after I came to know about Zolpidem has changed me. My whole personality has changed. I was not into this kind of, when you chase a snake, the snake is going to bite you. Or you even chase an ant, how big we are as a human being, and you chase an ant. You chase an ant. That will also bite you. Believe me, it's going to bite you. It's human nature. It's human nature. So, I have not decided what I'm going to do with the doctor. First I want to get out of this mess. Maybe, I mean, maybe, I mean, maybe, nothing happens to me. I'm 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 pretty sure that I will get out of this. But see, as a person who enters a storm and gets out of it, there is a change in the personality of the person, in the mental state of the person. If you are passing through, if a storm has passed through your life, there is a change in your perception per se, or your or your mental state. So I don't know, when I'm through this storm, what will be my mental state. I'm trying to be out of this, and several people are telling me that you will be out of this because my symptoms subsiding are subsiding. I'm getting little more stable, little stable. So maybe, I don't know, maybe I have no idea what I'm going to do after 3 months or after 6 months. I have no idea. To be very honest with you, I have no idea what I'm going to do after 6 months or after 3 months. About my life, about my job. I might take up the teaching which is being offered to me in the June semester, or I might not take. I might do a different kind of thing. I have not decided yet, because this was an unexpected storm. I was in the middle of going to Kolkata. And from Kolkata, I had entirely a different plan in my life, because I was planning to go to Kolkata, and from Kolkata I was planning to go to Bangkok. I was planning to go to so many places in the coming months of November and December and January. But there is a saying that man proposes, God disposes. So I do believe in the Almighty, in the powers of Almighty. And see, I don't know where my destiny will take me in the coming 3 months or coming 4 months. I don't know. I exactly don't know. Um, I mean, doctors also don't have any idea that when the symptoms will subside, they have an idea that exercise and diet and vitamins helps, but they have no idea that how that works with the brain chemicals. So I don't have any idea what I'm going to do in the coming 3 months, because I was planning to shift cities. I was, we were planning to shift cities. Uh, we were not planning a very long stay in this current city called Bangalore. But anyway, I mean, what is written here cannot be, you know, I mean, I didn't believe in all these things, but now you know, after canceling so many tickets, after going through this painful and terrible, you know, this terrible effects of Zolpidem, I have come to know that man proposes, God disposes. So I have to be, you know, I mean, whatever God, I have to come to a level of acceptance, uh, come to a level of acceptance when, you know, I have to sort of compromise with life, because if I don't compromise with life, then I won't be able to fight all this. So let's be patient and let's see what happens, and let's see what happens. And that's it today. I think I made a fairly long video, but I don't have depression, that's confirmed. Do I look depressed? Just tell me in the comments. Do I live? I have little bit of insomnia problem, and that insomnia, that half tablet of Seroquel or Q-tipping would have, you know, cured me. But this, I mean, every doctor I went to, they opined that this is not the right thing. Dr. Gosavi has done. Maybe, I don't know what came into his mind. Maybe patient retention. I mean, I think this type of people should why go for an MD degree? They should go for an MBA degree. I mean, if they get in IIM or some sort of MBA degree, and go to the marketing, the pharma marketing company, this marketing company, and market them to the patients. That is actually their main job right now with the doctors. And somehow they want to, you know, mm, I mean, it is up to us how we keep our health, what we eat, what we how much do we exercise, how we handle stress. That is up to us. If we leave everything to the doctors, that the doctor will take care of us, uh, they will, and that's not the, you know, mm, s- you know, in Bangalore, whenever I go to any hospital, I'm not taking the name. There are very famous hospitals here. Whenever I go to a hospital, I see that hip replacement and joint replacement come as a package. I, I, I exactly don't have any idea why would a healthy person need a hip replacement and a joint replacement. No idea. I mean, little bit of exercise, little bit of diet control can take control over arthritis or osteoarthritis, but I don't know. I mean, people are telling that how many stents you will put in your heart. Go for a coronary artery bypass graft, means CABG, bypass surgery. Bypass surgery is very painful, and there are after effects of the bypass surgery. Why do you take things to such an extent? So now I am very careful about my health, about my exercise, about my sleep. I will not compromise on that because I don't want to go for a hip replacement or a joint replacement or a sometimes cancer or autophagy. Autophagy, fasting for 16-17 hours, has been a proven technique. Scientists have proved it that it is a proven technique for mm, for not giving nourishment to the cancer cells. So fasting I can do. I mean, and again, it depends upon your threshold, how much fasting you can do. But it is generally advisable. I mean, it is generally advisable not to have a lot of food after you know after lunch. Again, I see people going for dinner, having um, butter chicken, oily dosa, biryani, and tandoori paratha, and all this stuff. I mean, I mean, it is in a multi-step process. If you finish your dinner by many, I mean, um, if you can skip altogether anything after 4 p.m., it's very good for health. You will not have diabetes. You will not have the metabolic disorders. It is generally advisable, but it depends upon upon your threshold, that whether you will be able again you have to follow a multi-step process and taper your eating. I have seen so many people not eating after 2 p.m. I don't eat anything after 2 p.m. And believe me, I've lost uh, I'm say 68 kilos now. I lost about 9 kilos, not eating and following a very tight ketogenic diet. Very tight ketogenic diet, no carbs, no sugar, fruit not after 10 a.m. and only high protein diet. It's difficult to follow. First you will have a little bit of nausea of not eating, but it is a very good thing. It's a very good thing. I mean, I did that without going to the gym, because last 3 months I was not in a position to go to gym. So I followed all these pizza and burgers and fries and chicken, KFC, and all these bread, especially bread. Bread has palm oil, which is a known cause for atherosclerosis disease. Especially bread, bagel, anything with that kind of thing. It has lot of palm oil, butter, and whatnot, preservatives. Especially, you should avoid carbohydrate, gluten, atta, flour, maida. I mean, little bit of vegetables, okay, but not that atta and gluten thing. Rice, roti, atta, and why do you need? One is just sitting in front of the laptop and working, sitting at one place and working. You are not having a, I mean, 50 years ago or 60, 100 years ago, people used to work 8 or 9 hours in the field and they used to eat. But what we are doing, we are just, in front of the laptop or computer, or, taking our bike out or taking our car out, and taking, everybody has three or four bikes in a house. So, what is the use? There is no physical activity, there is no nothing. What is the use of, stuffing yourself so much? That you should, one should do. It also gives rise to a lot of problems in later life. So that's it for today. I will share my diet video very soon, maybe by tomorrow. Tomorrow is Monday, yeah, I'm a little busy. Monday or Tuesday, I'll share my. Monday is today, tomorrow is my Bengali video day, so maybe tomorrow I will share. And one last thing, don't eat so much, please. Namaste, namaste, namaste. I made a relaxed video today, so namaste.